My name is Naidoo, and I'm an orthopedic surgeon. I practice out of Palm Beach, Florida. I am involved with stem cells through the long way. I was a research scientist, and I have a PhD in biomedical engineering. And I've done a lot of work in cell biology and stem cell research at Yale University, and carried on through a career in orthopedics. I'm practicing currently general orthopedics, although my expertise in general is joint replacement surgery. However, at this point in my career, I've come to the wonderful realization and awakening that we need more than just carpentry in the human body. We need something more significant to help us heal what the maladies that we are going through. And the less invasive and more science we use to effectively treat us, the better. Personal cellular therapy is what I would select at this point. I've seen it from a simple aspect of accelerating the results. I've seen patients heal 3 times faster than the natural history of such surgeries. Well, firstly, the cord blood product is natural. So no matter whichever direction you come from in medicine, one has to agree that umbilical cord blood stem cells is natural. And it's very difficult to argue against natural therapy. We're not poisoning the system. And Dr. Toffee will tell you that we've been using cord blood stem cells for hematopoietic reconstitution for decades now. People have had chemotherapy or radiation therapy. Now, the stem cells itself, one of the things that we can say about it is that it's the most powerful anti-inflammatory that we can get. So the results I see immediately when I infuse it or inject it into people, that the inflammation is quenched, whether it's from inflammation post-operatively or from inflammation from an autoimmune disease or from a disease such as fibromyalgia or MS. We see a very significant calming of the symptoms that can be associated with acute inflammation. I see a lot of patients with knee osteoarthritis. And in combination with Invitrix, we did a pilot study in which we selected randomly 10 patients who were coming in for knee replacement surgery by me. And we did a pilot trial on injecting them with stem cells instead. We did initial x-rays and MRIs, and we injected them with the cord blood stem cells into the affected knee. Our results thereafter were surprising. We followed the patients with the metrics that we had chosen, which is the visual analog scale, the Oxford knee scores, the American Academy of Orthopedic Surgeons knee society scores, and also we followed with blood work at 2-month, 4-month, and 6-month intervals, and now we are approximately a year out from this study, and the results still continue to amaze me. 80% of people who received the injections into their knees had complete relief of pain, between 89% to 90% relief of pain by the visual analog scale, and the functionality scores were very impressive. Only one of my patients in the study of 10 went on to have a total knee replacement. That is a patient who had Parkinson's disease, and he was unable to tolerate pain and gait abnormalities from the Parkinson's. I developed psoriatic arthritis, which was a very significant systemic form, approximately 15 years ago. And I started on very aggressively on all the medications to treat it, including the biologics that we have available today. And I ran the gamut of medications all the way from methotrexate, Enbrel, all the way down to Remicade intravenously. The average cost per month was running me about $3,000. I did not see any relief of the symptoms, and it was very significant and debilitating to my life and my career as an orthopedic surgeon. 6 years ago, at the same time as I started using stem cells and working with Invitrix, I decided that I would become a patient. And ethically, I would only inject these cells into somebody else if I felt it safe enough and proper enough to inject into myself. I received an infusion of 4 cc's of cord blood stem cells. Within several days, I saw a relief of symptoms very significantly. Systemically, the joint pain was gone, and I stopped using any medications. And now, 15 years later, I am still just as healthy, I hope, and just as young, I think, and I do not require any medications.